Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today I'm going to be talking about ectopic pregnancies. What are they, how do they occur, how do we find them, and how do we treat them? So if you're interested, please keep watching, and don't forget to like, subscribe, and comment. Thanks. Alright, so ectopic pregnancies. Before we talk about abnormal pregnancies like ectopics, we need to talk about what is normal. So I'm sure if you're watching this video, you know by now to become pregnant, you need to have an egg, which is released by the ovary once a month during something called ovulation, and a sperm. When egg meets sperm, they fertilize together, make a fertilized egg, and then that travels down the fallopian tube, so the tube that connects the ovary to the uterus, down into the uterus, and then embeds into something known as the endometrium, or the endometrial lining, the inner lining of the womb or the uterus. Right, so that's what normally happens. An ectopic pregnancy is one that occurs where egg meets sperm, but does not make it into the uterus per se. Sites of ectopic pregnancies can include, most commonly, in the fallopian tubes themselves, but can also occur in and on the ovary, on the cervix, or outside the whole system altogether. That's much more rare. Like I said, the most common is still within the tube. And the thing is, without the endometrial lining, so the inside of the womb, a pregnancy cannot be sustained. So an ectopic pregnancy is never viable. In fact, it's actually really life-threatening for the person who is pregnant, because an ectopic pregnancy will release pregnancy hormone just like any other pregnancy, beta-HCG, and you'll have signs and symptoms of being pregnant, a positive pregnancy test, feeling nauseous, you name it, except if it's not in the right spot, there will come a point where the tissue will continue to grow, so the fertilized egg, which may cause a rupture of whatever structure it's actually embedded into. This is why it's incredibly dangerous. In the abdomen and the pelvis, someone can bleed liters upon liters of blood before you even notice. So it can be a very quick thing and incredibly life-threatening. Most ectopic pregnancies occur without any known cause. There's no reason for it. It's incredibly bad luck, as one would say, which can be a really difficult thing for someone who's going through it. And I want anyone watching this who's ever had one to know it's not your fault. You didn't choose this. You didn't do this to yourself. There are some things that increase your risk of having an ectopic pregnancy: having a previous ectopic pregnancy, having endometriosis, falling pregnant whilst on contraception, including but especially the Mirena IUD or Kylena, similar thing, having pelvic inflammatory disease, which is a inflammation and obviously infection of the pelvic organs, so the uterus, the cervix, the ovaries, you name it, which are commonly secondary to sexually transmitted infections, so chlamydia and gonorrhea most commonly, but again, not all PID or pelvic inflammatory disease is because of STIs. And fertility treatments can also increase your risk of ectopic pregnancies. So if they begin like any other pregnancy and you have the normal pregnancy symptoms, how do you know if you're having an ectopic pregnancy? Well, there are some warning signs. Fluctuations in symptoms can be one of them. Fluctuations in your pregnancy hormone, beta-HCG, can be another, but you won't really feel that, so it's not a symptom. Symptoms may include vaginal bleeding. So if you've had what feels like a period, but you're testing positive, or you have some bleeding in your pregnancy, really have to find out if it's an ectopic or not, because if it's not within the lining can still shed, there's still a pregnancy, and you can see where this is going. Other common symptoms include quite severe abdominal pain or pelvic pain, and sometimes for some people it's actually more one side than the other. And another classical sign, which is not always present, is shoulder tip pain. So pain in the tip of the shoulders around here. Sometimes we do pick up ectopic pregnancies on ultrasound. So if you're going in for a 6 to 8 week ultrasound and you are certainly pregnant and you're sure of your dates and we don't see a pregnancy within the uterus, we need to make sure it's not outside of it. Ultimately, if we can't find it on ultrasound, but we highly suspect an ectopic pregnancy, the only way to investigate from there is to actually do what's known as an exploratory laparotomy. That is keyhole surgery to try and find it and explore. Of course, during the workup of an ectopic, you'll also likely get blood tests done, mainly to look at your pregnancy hormone, liver and kidney function, hemoglobin, iron, and to know your blood type. So if you do, for whatever reason, have a big bleed, we can transfuse you ASAP. So treating an ectopic depends on how far along you were when we found out you have an ectopic pregnancy. If it's early enough, we may be able to give you a medication known as methotrexate, which arrests the development of the cells and allows the pregnancy to be absorbed by the body itself, which is kind of cool and kind of creepy all at once to think about. However, if methotrexate is not an option for one of many reasons, including it's too far along, the only real way to treat an ectopic is to surgically remove it. Again, quite commonly through keyhole surgery, like I was talking about before. Sometimes, especially in the case of it being ruptured, we actually have to take the tissue that the ectopic pregnancy was adhered to, which can mean losing a fallopian tube. Sometimes it can even mean losing an ovary. And rarely, which I've never seen personally, but again, I'm not an obstetrician gynecologist, can actually result in hysterectomy. Again, this is rare and it's more theoretical and hypothetical than anything, but just know it does come with risks. So what do you do if you suspect you have an ectopic pregnancy? Get in touch with your doctor ASAP. We, like I said, can do ultrasounds. If we can't see any evidence of an intrauterine pregnancy, even on transvaginal ultrasound, which is the uncomfortable one that, as the name suggests, goes via the vagina to look into the uterus, then we talk very urgently to an obstetrician gynecologist about what next. And there you have it, guys, Ectopic Pregnancies 101. If you have any questions, let me know. Don't forget to like this video if you liked it and learned something, and subscribe if you haven't already. Leave me a comment about, again, questions about this video or what you'd like to see from me next. But until next time, guys, stay safe, stay healthy, and I will see you in a video very soon.